Hi everyone, it's your friend Doris, Thecoder, back with another video. And today's video, I really want to talk about a little of the preview, the changes that we're going to see in the areas that I deal with most often. I'm a multi-specialty coder, auditor, and consultant, owner of DB Healthcare Consulting and Breaker Coding Camps, and author of the Real World Coding Camp. So if you're new to my channel, that's who I am. Welcome. If you are a subscriber or returner, thank you and welcome back. So I'm going to be talking specifically, very short video. I won't go into great details, but there's some changes you can implement today so you stop losing reimbursement if you are in the anesthesia space, and also some changes you want to be aware of. I don't have the 2022 Crosswalk Manual and Relative Value Guide yet, so I'm not sure if that will be corrected and we'll see these codes there. But again, this is something you can implement immediately. So right now, I'll start with cardiac. Very excited. If you code interventional, we are now getting unique codes for congenital conditions like coarctation of the aorta. For those of you that might not be aware of that, or you see that condition, you're not clear what it is, that is just the niche congenital name for a stenosis. It is an aortic stenosis, not one that's caused by something like atherosclerosis or arteriosclerosis or anything like that. It is just a condition that your body just does that. It automatically did that. It always did that. It wasn't caused. That's really what congenital is. They may not find it till later, but the body doesn't normally kind of do that. So they infer that you are born with that condition and it's congenital. We have 3 new codes in the interventional cardiology space. CPT codes 33894, 33895, and 33897. I am also super excited because although I got it late, I have my 2022 book. I don't know about you guys, but like when I get my books, I hate the little white specks that are all over my desk, but all in all, I love to get the new books and find out what's going on. So if you code interventional cardiology, you will see 33894, 895, and 897 for the angioplasty and stenting. If you are coding those today, what you're reporting is 37236 for your stent and 37246 for your angioplasty. This is going to be important for you if you code in the anesthesia space. So if you're an anesthesiology coder, this is something that we covered at the Decision Health Conference this year in Orlando. I know everybody didn't feel comfortable traveling to that. We could tell kind of by the numbers that we have. Thank you for those who did come. I want to make sure you don't miss that though, because it's something that affects our industry. It's a loss of RVUs with the work. So again, I want to make sure you don't lose that. If you code those conditions today, we're using CPT codes on the interventional side, 37236 for the stent, 37246 for the angioplasty. However, if you are coding anesthesia, this is one of those times where you want to go ahead and use the ASA's guidance that you can disagree with it and disagree with what they recommended. The ASA recommends for the stent, strangely enough, is they actually give you the proper option for an aortic procedure for the angioplasty 37246, but they don't give it to you for 37236. The codes that come up in there are 01924, which is artery not otherwise specified, as opposed to big red, as I call it, the largest artery in the body. 01650 and 01770. Neither of those is really appropriate if the aorta is a structure that you're dealing with. So if you see the condition reflected as coarctation of the aorta, again, that's just another name for stenosis that isn't caused by, it isn't acquired, the patient's born with it. You want to make sure you disagree and do not report 01924. If you report 01924, you're going to be submitting lower base units. And yes, could you argue the case? I personally feel comfortable arguing the case. I'm actually publishing this, so it'd be pretty unwise for me to publish this if I felt like I couldn't support that. We have a code for transcatheter interventional or therapeutic procedures of the aorta. That code is 01926. It is not 01924. So it could have been a typographical error where that was missed, but if you do not catch that, you are losing about 4 base units depending on your payer for that specific code. So if you are coding coarctations, and really congenital is what if you didn't attend the session or you didn't feel comfortable, you actually missed a lot of information, but there were a few options I gave you where you might want to disagree with the ASA crosswalk reference that they gave you, and I gave us pretty thorough rationale for that. Some of them are beneficial to you. So some people may not want to do it. Some of them, like this one, are not beneficial to you if you follow the ASA. But my goal always is revenue is never the primary focus. Compliance is. So I know I can support that. So I feel if I stand on being able to support those when we have a 1924 that should be a 1926, I must also be willing to stand on it when the code that I feel is most appropriate is also of a lower value. So I do not have, for the anesthesia coders and auditors listening, I do not have my 2022 ASA Crosswalk yet. It's my understanding they ship about February. I have those orders. Stay tuned. There'll be another video for that when I have that done. But again, if you're coding those conditions, feel free to disagree. Those interventional procedures, feel free to disagree with the crosswalk. Again, the rationale is we have a unique code for aortic, so we would go ahead and use that so you don't lose the revenue for your practice. Again, I'm your friend Doris Thecoder. Like the video if you do, subscribe to my channel. Also, stay tuned if you did not attend the DH conference. There is a Q&A on my channel. It was the last video I did with my friends Kelly Dennis with Kelly's Anesthesia Tips, Amy Turner, Marcy Garuccio, and Dr. Laura McNeil. We did a session to answer some of the common questions, so maybe you can get some of the information missed there. And Kelly and I will be doing a collaboration on a couple topics upcoming in the next 30 days or so. We both have crazy schedules, so we're trying to facilitate that. So pause for a minute, go ahead and go over to Kelly's Anesthesia Tip. Kelly Anesthesia, okay, speak right. Kelly's Anesthesia Tips on YouTube. And subscribe to her channel, subscribe as well, turn on notifications so you know when we are going live. We'll try to give at least a week notice so you know when we're actually going to do it. I will be posting it on my LinkedIn. Kelly will post it on her LinkedIn, as well as our Facebook pages and whatever forums allow us to post it. We like people to kind of subscribe to the channels because it really becomes quite tedious posting on all of the forums, and some of them want permission, and some of them, believe it or not, even want a commission. They want me to pay them for giving away information I give for free, so go figure. Not doing that. So thank you for coming by my channel. Remember, 2022, if you're coding these codes, feel free to deviate. If you are working for one of those practices that doesn't like to buy books every year, this is not the year 2022 to not buy a book. We are seeing changes in ENT, in my specialties. Anesthesia has new codes this year. Pain management has new codes this year. Interventional cardiology has new codes this year. Cardiothoracic, if you're doing open, that has new codes this year. We're even seeing some changes in electrophysiology, another specialty that I deal with. So if you have a provider that really doesn't like to buy books, or they don't like to pay for it, you really want to have them encourage them to bite the bullet this year. It's absolutely going to be worth it, and there's going a lot of clarifications relating to E&M as well. So again, I'm your friend Doris Thecoder, back with another video. And you know what I say, like it if you do, share, subscribe, turn on notifications, and check out my friend Kelly's channel as well. We'll be doing a collaboration, and until the next video, I will see you then.